Welcome back, Facebook. Thank you for joining us to another Facebook Live video. I'm Dr. Alan Van Scoyk, chiropractor and owner here at the Chiropractic Company, and of course I'm joined with fantastic Dr. Botros. Yesterday when we were deciding what we want to do as far as this video is concerned, once again we had a variety of different topics that we were going through, and Dr. Botros said, Dr. Van Scoyk, what I really want to do is I want to make sure that the people who are watching this get something that they can do at home, something that they can do to help themselves out if they're not here in the office. So today, one of the big topics that we've been hearing from you guys is about headaches. We had a lot of patients over the past week come in with a variety of different headaches, and so Dr. Botros is going to go through a couple different headaches and a couple different things that you can do when you're not here to help those out. Of course, we both really enjoy taking care of headaches, and patients who have headaches get fantastic care here. But these are some things that you can do when you're not here. So give us a couple ideas.
So first thing that we need to recognize is that headaches are typically trying to tell you something. So most of us should not be having headaches. And even patients who come to me and tell me, oh, it's not a big deal, I get a headache maybe once a week. That's about 52 times a year if you really think about it. And that can take away from your quality of life, from your ability to focus. And so you got to realize that your headaches are probably trying to tell you something when it comes to your overall health. Now there are many different types of headaches, and today we're only going to be covering two, and those are the two most common ones. So there are sinus headaches, occipital headaches, cluster, migraine, you name it, temporal, we have it, it's out there. So we got to identify the two most common ones. The first being occipital, or also known as suboccipital. Now how do you know if you have this headache? And one of the first things you'll notice is you have a lot of tightness and tenderness behind your head here, like kind of at the base of the skull or the upper neck. Another really common sign too is it's kind of difficult to turn your head side to side. Those are two common signs that will tell you, like, hey, maybe you have a suboccipital or occipital headache. So there is a few things you can do to help treat that. So what causes this, first of all? Most important thing is posture. So mostly when we're looking down like this, it stresses those muscles quite a bit when we're slouched over. The other thing that we see is poor sleep posture. Now these are two topics that we've actually created videos for, where we give you guys stretches and things to be mindful of to be able to make sure that everything's where it needs to be. So those are the two most common things. So if you're dealing with any of that, one of the best things you can do is you're going to take your fingers like this and create an L and an L, okay? And then you're going to bring the L kind of right behind the ear and place your thumb right at that tender area. And you're going to know exactly when you're on it.
Feel it right away.
Yep. And what's very common is as you put a pressure, is it might actually make the headache a little bit worse. That's okay. We're doing something here called active release technique, okay? And so as you put a pressure in there, it's going to get a little bit tender and it can actually activate the headache temporarily, and then as soon as you release the pressure, the headache should be lowered or completely gone, okay? So you're going to hold it and you're going to push there for about 10 to 30 seconds. And when you'll know when you've done this correctly is you'll feel like the pressure that you're putting in is no longer as intense. So it's almost like the muscles are just like they're relaxing.
It almost feels like it melts underneath your thumb or underneath your fingers. You'll feel it and it'll just kind of soften up like melted butter.
Exactly. And it's really important that as you're doing this here, you're taking really deep conscious breaths in and out to help get the oxygen to those muscles and to help them relax. Now if you do that, guess what? You may have to do it once or twice. That can really help reduce the occipital headache in there, okay?
I always say it's an important part for patients to continue to breathe, continue to get that good healthy oxygen. One of my favorite things to say, it's a bad sign when a patient stops breathing, so we really need you to continue to take in good oxygen. That'll really help out with this kind of an issue.
So that's the most common one that we see. The second most common one is called, it's a referral kind of headache. So you'll feel it usually on the sides of your head, kind of above the ear, and it goes almost into a question mark orientation. And sometimes you'll get it on both sides, like a temporal headache, or on one side, or maybe a little bit stronger on one side. Now one of the most common reasons we get that, believe it or not, is going to be stress. And where it comes from is not this area, so you don't really want to be pressing on the sensitive structures on the side of your skull here. Where you do want to press is you're going to take your fingers like this, and you're going to poke on these muscles here, known as the upper traps. And you'll find it might feel pretty tender to the touch, and you might feel like a little marble trigger point almost, where it's like, oh yeah, that area kind of feels a little goofy, and it kind of hurts. And we're going to do the exact same thing that we did with the suboccipital. So instead of an L, you're going to take your hand, and you don't want to use it on the same side shoulder because you're not fully relaxing it if you're doing this. So you're going to take this arm, go to the other side, you're going to pin it, breathe deeply, it's a good sign, like he said, and then allow that muscle to just melt like butter and to relax. And again, it is very normal if that actually makes it a little bit more intense temporarily, and as soon as you relieve the pressure, the headache should be calming down and diminishing.
There's a study that showed almost over 90% of the patients that have that type of a headache will have tension in through this area and through here. Now, if you've worked with us in the past, you'll know that as we start working in there, there's a lot of you that have that tension in there. So it's real important for you to try to manage that and maintain it. Once again, get in there, work that muscle down, find that spot, get it to settle, and that will really help with that headache. There's actually a cranial nerve called your spinal accessory nerve that runs from your brain down into that area and innervates in through there. So if we can get that to calm down, that nerve that's going back into your head, once again, will have less potential for irritation. Really, really helpful.
Absolutely. So it is really important to notice that, hey, if this is something you're dealing with for long periods of time or on a consistent basis, helping with the muscles is really good, but it might not be getting to the root cause of the issue. Like Dr. Scoyk said, that accessory muscle there, or nerve that goes to those muscles, if there's irritation on it, that should be corrected. And we see again, because posture, stress, poor quality sleep positioning, and things like that can really activate and trigger these types of headaches, it's a really, really good call to make sure that you're getting to the root cause and getting it professionally assessed. And the last thing I want to add to that is when it comes to both these types of headaches, your best friend is going to be heat. So don't put ice on it, you want to put heat based on, so in here, on the upper traps, if you have that side temporal headaches, or on kind of the upper neck, lower base of the skull to help calm things down, especially after you do the trigger point releases here.
As most of my patients know, I love ice. I'm a huge fan of ice. Ice is great for most injuries, especially 4 to 6 days following the injury. But when you have a chronic issue, if these headaches are chronic and consistent, like you said, they keep coming back, sometimes that heat will really soften that up. Start to bring in new blood flow to the area, start to bring in new oxygen, which can restart and kick in that healing process. Now, we don't want to do long periods of heat because that can cause some damage. But short periods of heat can really soften that tissue up quite a bit.
Awesome. So those are the two most common headaches. Hopefully you guys got something out of this. If you like it, feel free to share it with anyone that you know that has headaches. Dr. Scoyk, where can they get more information?
So yeah, if you're continuing to have these issues, once again, if you're doing this work on your own, it keeps giving you problems and you want to get it professionally checked out, obviously come and see us. We're at the Chiropractic Company in Glendale. You can go to our website, www.chiropracticco.com, or you can give us a call at 414-332-0859. That's a great way to get a hold of us. You can also follow us on Instagram or on Facebook, which you're obviously hopefully doing right now if you're seeing this video. Those are also great ways to see our content and to be able to get a hold of us for any other questions or concerns.
Yes, and if your friend shared this video with you or added you in you know the comments, be sure to thank them because that's a good friend.
That's a good thing.
In my
Good
book.
friend. Yeah. All right. Thank you for
Awesome.
watching. We'll see you in our next video.
Take care.